Madam Speaker, I'd like to agree with the member opposite, but then we'd both be wrong. I rise today to speak in support of the principle behind Motion 11, the urgent need for stronger provincial oversight in the delivery of methadone treatments and other opioid replacement therapies in New Brunswick. No one in this chamber here disputes the value of medically assisted treatment, or MAT. It is a proven and effective medical tool that helps individuals recover from the devastating grip of opioid addiction. We've all seen the damage opioids have done to families, to communities, and to our province. I shouldn't have started that word. Buprenorphine, naltrexone, and methadone are all opioid antagonists, which should be administered under medical supervision. But, Madam Speaker, this motion reminds us of a critical truth. Methadone, buprenorphine, naltrexone, those three, they alone are not the cure. And it's only one part of a much larger process, a process that must include mental health supports, counseling, housing, community reintegration, and without these supports, treatment is incomplete, and an incomplete treatment can do more harm than good. So the motion before us seeks to ensure that methadone treatments in New Brunswick operate under provincial proper oversight. Oversight that guarantees quality, accountability, and safety for both clients and the broader public. So why is oversight so necessary? Because experience across Canada has shown us that when oversight is weak, the system will fail. And when it fails, the consequences are devastating. Improper administration, as we've heard before, can lead to worsened dependency, and addiction to one substance can effectively be transferred to the treatment itself. So without strong oversight, some clinics may treat methadone as a silver bullet, assuming that simply dispensing medication is enough to resolve the deep social and psychological wound that addiction leaves behind. And we know better. Addiction is a complex tied to trauma, poverty, homelessness, and untreated mental illness. A prescription alone will never heal those things. Oversight ensures that programs remain grounded in evidence, compassion, and the full spectrum of care recovery demands. Now, clinical psychologist Dr. Julian Summers, who has spent over 3 decades studying addiction, mental health, and homelessness, put it very clearly in an interview last November. And I quote, "There was never strong evidence to support the idea that providing people who are homeless and unemployed and socially alienated with drugs or a new type of drug is ever going to substantially improve their well-being." Madam Speaker, Dr. Summers' point is not to discredit harm reduction. It's just to remind us that harm reduction without a path to recovery is an incomplete program. It's an incomplete promise. Without comprehensive interventions, programs risk failure and worse, public backlash. So another reason this motion is vital is the growing evidence that prescribed opioids intended for treatment are sometimes diverted into the illicit drug market, which we've already spoken to. In February this year, Radio-Canada reported on a leaked BC Ministry of Health document revealing a significant portion of prescribed opioids was being diverted and trafficked, both provincially, nationally, and internationally. So this is not an isolated incident. The City of London, Ontario faced a similar challenge, where Police Chief Tai Trong reported the diverted safe supply was being resold into communities and even used as currency to produce fentanyl. Half of the opioids seized by London Police in 2023 were prescribed. So if diversion can happen in Ontario and to BC, why should New Brunswick be considered immune? Oversight is not about punishment or suspicion. It's about prevention. It ensures that our good intentions do not become someone else's nightmare. Nowhere is the need for oversight more evident than in private methadone clinics. Across our province, these clinics are often where we see individuals loitering outside buildings, visibly high, waiting for their next dose. and patients may receive the same dose a day after day without the wraparound supports needed to break the cycle of addiction. This perpetuates that toxic cycle, repeated highs, withdrawal, and repeated exposure to the streets and unsafe environments. So this is not just a problem for patients, it impacts communities. When private clinics operate without rigorous oversight, public safety is compromised. Streets become unsafe, patients remain trapped in a cycle of dependency. To maintain public confidence, provincial oversight must ensure that every clinic, public or private, must adhere to the same high standard of care. Real-time prescription monitoring, adherence to dosing best practices, integration with mental health services, and coordination with housing and social supports. Only then can MAT be a true path to recovery, not just a daily dose. We've seen similar concerns right here in this province. In Fredericton, the Riverstone Recovery Centre has been at the centre of public debate. Some downtown residents and business owners have voiced worries about rising crime and disorder in surrounding areas. To be fair, the centre's operator, Dr. Sarah Davidson, has denied that her clinic is directly responsible for any increase in criminal activity. Yet even she told CBC News that providing a safe supply is just part of the solution. We've heard from our blogger friend Charles LeBlanc how bad that situation is. She's emphasized that additional supports, including mental health services and stable housing, are essential to help people truly turn their lives around. And that, Madam Speaker, is precisely the point. Even those delivering these services recognize that medication alone cannot solve addiction. Recovery is not simply about substituting one drug for another. It's about rebuilding lives with stable housing, therapy, community connections, and a sense of purpose. The need for wraparound services is essential, and I will be speaking to that in another motion later. Compassion is abundant among healthcare workers, addiction counselors, and recovery advocates. They're doing heroic work, often under immense pressure and with limited resources. But compassion must be matched with competence and accountability, with a system that monitors outcomes, tracks prescriptions, prevents diversion, and ensures continuity of care. We cannot at this time afford to be naive. When oversight is weak, the consequences appear in our emergency rooms, which are already overburdened. Our police reports, more paperwork and people at risk, and in our obituaries. That is why Motion 11 matters. It is about building a system that just doesn't hand out hope, it follows through and rescues people. Some may argue we've already made enough rules, professional standards, and yes, inspectors. Well, okay, but clearly those measures are not enough. Across Canada, diversion and unsafe practices still occur, even in provinces with advanced health oversight systems. We are not suggesting that we reinvent the wheel, only that the wheel be firmly locked on. Provincial oversight must mean real-time monitoring of prescriptions, coordination with law enforcement to prevent diversion, integration with mental health services, housing and social supports, outcome-based evaluation of all treatment programs, including private clinics. This, my friends, is not a partisan issue. It is a human issue. Addiction destroys lives, and there are very few here among us who have not felt it in one way or another. Poorly designed action can do just the same. We owe it to those struggling with addiction and to their families, their neighbours, and their communities to ensure that care is safe, comprehensive, and accountable. Oversight is not an obstacle to care. It is the foundation of trust in that care. In closing, Madam Speaker, Motion 11 asks us to strengthen the system, not to restrict treatment, not to stigmatize those in need, but to ensure that methadone is delivered responsibly, safely, and as part of a genuine recovery plan. MAT is a lifeline, but that lifeline must be anchored to mental health support, housing, community reintegration, and responsible provincial oversight, especially in private clinics where the risk of diversion, loitering, and repeated high-dose cycles are the greatest. We can and must do both. We must treat the addiction with compassion and manage it with accountability. That is the balance New Brunswickers expect from us, and that is what we ask of government. Thank you, Madam Speaker.